While many were worried about drastic cuts to various aspects of human services funding, House Republicans worked to find a way to ensure that when revenue is down, the neediest receive care. Despite an initial proposal to cut that funding by 20%, more than half of that funding was restored. Human Services won in a variety of areas, such as receiving more funding to reduce the size of waiting lists for the intellectually disabled. Over $17 million was added to help move 700 special education graduates and 430 people on an emergency waiting list that have elderly caregivers. Reducing the waiting list helps to lower the number of people that use county-based services.
We put in $17.8 million for this waiting list initiative this year, and this kind of funding is unprecedented. The elderly parents in the Commonwealth of Pennsylvania, some well into their 80s and 90s, that are caring for an adult child at home with intellectual disability, and the adult child might be 60 or 70 years old. And these types of family situations exist in every district across the Commonwealth. The other population that the waiting list refers to are young men and women who are graduating from school, from high school, or are aging out of the public school system at the age of 21, who leave their formal education and literally have no opportunities awaiting them, whether it's training or some sort of employment opportunity or what have you. But those types of opportunities are now being provided with this $17.8 million appropriation in the budget.
Other restorations came in the form of a pilot program for county block grants launched for 20 counties across the Commonwealth. This program will give counties a lump sum to use towards human services. This would allow counties to allocate more money to various programs in need instead of the state deciding how much money goes to each individual line item. This gives counties the flexibility to help those most in need. There was also a $65 million increase to the Intellectual Disabilities Community Waiver Program. $48 million of that was added by the legislature. This program helps the intellectually disabled live more independently.